There are many different angles to consider right now in the ongoing fallout after an investigation into 15 behavioral health providers that started in 2013. And as you know, all but 2 providers have since been cleared of financial wrongdoing by the state attorney general, but several went out of business and services were disrupted in recent years for many New Mexicans who needed critical behavioral health and substance abuse services. And here's the latest development. The Arizona-based company La Frontera that came to New Mexico to take over services when Medicaid funding was cut off for the local providers is suing Optum Health New Mexico and associated parent companies. And La Frontera alleges that Optum Health is the source of fraud and misrepresented the situation, which cost La Frontera millions of dollars. We'll see about this. I'm joined at the table by Janice Arnold-Jones, former state representative. She's with us. Inez Russell-Gomez is back, editorial page editor for the Santa Fe New Mexican. Laura Sanchez-Rivey, an attorney at Cuddy & McCarthy LLP. And Stephen Spitz is back. He's host of New Mexico People, Places, and Ideas on KUNM 89.9. Stephen, wow, this is a biggie to me. What's your initial reaction to this lawsuit? Because a lot of people there's a big finger pointing in 2 very critical directions here.
You know, first of all, this is our first real window into how and what actually happened in 2013. But just to back up for a second, you know, there was, what happened was, according to this complaint, Optum convinced the state to order an audit. And the audit supposedly revealed $36 million in possible fraud. At that point, the state cut off the funding to these 15 providers that you mentioned, all right? But since that time, just recently, actually within the last month, Attorney General Balderas has cleared 13 of the 15 providers. You said the other 2, there's no implication that they've done anything wrong. And he's released the audit. And whereas the state said that there was clear evidence of fraud revealed by the audit doesn't actually say this. All right, so this is a head scratcher. Why would a governor, why would an administration that touts itself on being business friendly and has tried to encourage business, why would they get rid of 15 New Mexico companies and bring in an Arizona company? Well, the explanation is the one basically you gave. According to this complaint, Optum just couldn't control its system. It was losing money. It didn't have the proper claims procedures, operational procedures, any procedures. And it was about to leave the business. It was going to be replaced by a new intermediary. The intermediary pays the providers and supervises the providers. So Optum, according to the complaint, devised an exit strategy, which is to claim that the 15 providers are committing fraud. It would then exit. It could keep the money owed to the providers. It would bring in this Arizona company. The Arizona company it would integrate with. Everything would be fine. The new intermediary would come in, and Optum would go off into the clouds somewhere.
That's right.
But the problem was that, according to the complaint, Optum never got its act together with the Arizona company, this La Frontera company. It didn't pay them for the startup costs, which it promised to do, and according to the complaint, millions and millions of dollars are owed to La Frontera, and $18 million are owed to these 15 providers. Then when you look at the actual release of the audit, it turns out there was $42,000 in questionable claims. That's about $3,000 per one of these 15 providers. Okay, that then was extrapolated to $36 million.
That's right.
So, you know, basically, the whole thing looks like, it almost looks like the state was a victim.
That's right.
The state was taken in by Optum, at least according to this complaint.
Right.
And there's really nothing to the fraud claims.
Interesting. Inez, pick up on that. That's interesting, isn't it? That we're starting to see a semblance of a trail here now.
It is, and the beauty of a lawsuit is that once you do that, you can get subpoenas, you can get people, force them to testify, get records. I mean, even if that was the reason, if Optum was pulling the strings, though, it doesn't excuse the state for reacting to the audit in the manner in which it did. There was no reason for them to cut off the 15 providers the way they did. That was never necessarily, they always said it was mandated by federal law, but that, I don't think the reporting since then has proved that wasn't true. And they have to live with the idea that thousands of people lost crucial services, people lost their businesses, and a lot of people lost jobs, and millions of dollars left New Mexico.
And people didn't get the behavioral health services.
Yeah, they lost their
right.
services.
Yeah.
Now,
That's
some
right.
of the members of our congressional delegation are asking for a federal investigation, which is another layer of scrutiny, because I think New Mexicans really deserve answers. And I don't think that the governor or her people have ever been called to account for what they did to basically wreck, people's livelihoods and their
Interesting point
services.
there. Yep. Interesting, I'm looking down at this story in the journal, Laura Sanchez-Reve. It's, when I see La Frontera, blaming its subcontracted providers for billing errors that United characterized as institutional fraud is what Stephen mentioned. This idea that you could take a piece of software and extrapolate from 44 grand roughly out to 30-some million dollars with no checks and balances, no one saying, no, wait a minute, you need to prove this, you need to show this to me where all this is happening. You see, we're going to get some light here, aren't we? This is going to be very interesting for the state.
Hopefully we will, but we have to do a reality check, and I think that's one of the reasons that Steve was mentioning in the complaint. This is a complaint. A complaint by nature is filed by attorneys that are basically for the plaintiff. They're filing a story
Fair enough.
that captures the plaintiff's argument. The defendant is going to come back with a denial of all of the charges that are in there, a story that's different. So then we're going to have two contested narratives that are going to be going forward.
Right.
And basically in the context of this case, hopefully a lot of information will come out, but cases like this don't typically go all the way to trial. We're talking about a long timeline and a lot of discovery that is not public.
Right.
And so, it's likely to settle at some point, probably, because we're talking about two big medical providers and a lot of proprietary information that they don't necessarily want to air. So I don't know that we're going to get to the bottom of it. And I think what we really care, I think, as consumers of medical services and just of citizens of the state is how did that decision get made at the state level that things we're going to get basically pull the plug on 15 providers and then switch over to an Arizona company. That's the sort of information I think that people are wanting to understand. How did this happen and why did we agree with this out-of-state audit that obviously used projections and not actual evidence of fraud?
Is that on the state to you, Representative, that the state was obligated to look into these charges perhaps a little bit more as an honest third broker between the state citizens and this provider to say, okay, let's check out this 34 million and see what's going on here?
Absolutely. One of the first things you learn as a legislator is liars figure and figures lie. And as a legislator or an elected, it is your job to know the difference, which means you have to dig into it.
Right.
And so is this a case that the governor was trying to follow the law and as a prosecutor, perhaps overzealous, but she said there's fraud, what you do is cut this off. And was that the right action? For me, the follow-up question still remains, where was due process for these companies? And even if you have a federal contract, and the law says that if there is suspected fraud, you get to be cut off. But then there is a follow-up. I've never heard this. And so why didn't we look into it? Why did we just take their word? And there's one other piece. If I'm not mistaken, this has happened in 9 other states. This is not unique. So is this massive fraud kind of like the hedge fund frauds? Is this what it is? But the bottom line is it's something. We don't know what it is.
I got to wonder, I'm glad you mentioned that because Inez, I'm wondering if the original company out of Boston that we paid $3 million to with this initial report that started this brush fire basically, once the lawsuits start, it's like everybody gets touched up after a while. Do you know what I mean? I'm wondering if these folks are going to get touched up a little bit
Well,
too.
they got touched up, I think, just in the reporting of what happened because they had done the same thing in North Carolina, and those findings did not follow through. And in audits, even if there's a contention of fraud, you have a right as the company being audited to say, here's my bills, look, you're wrong. And they were not provided that opportunity. And in the bigger picture, the question I've always had, and I have not been able to get answered, is why do you need to pay $1 billion to a company to manage your behavioral health services?
Right.
Medicare works. I took my mother to the doctor, she filed her Medicare, they paid it, she paid her part. There wasn't a company helping her manage it or helping the state manage Medicare or the government manage Medicare. So what is it about our health care that we want to give these middlemen all this money, which they then seemingly mess up? Right. So why can't the legislature come back and say we need to do this a different way?
Well, I mean, which begs a bigger question. Do we have health care or do we have insurance?
Yes, we have insurance.
And we have, this is the biggest insurance player in the country, as
Yes.
near as I can tell. We have insurance, we don't have health care.
Good point there. When we return to the line, we'll talk about the rising cost of Medicaid matches for the state.